Hey guys, just a reminder, this is not official medical advice or such. Please seek an appointment with a licensed medical provider. Welcome back, everybody, to another episode of Explain This. I'm with the star of the show, Robin Riddle. Robin, how's it going?
Doing great. How about you?
I'm a little nervous about the topic. I'm naive around this, so we've got a really cool topic today, and I'm sure you've seen it by the title. What are we talking about?
We are talking about IUDs today.
Yep. And IUDs, something that's, commonly talked about. I know you counsel patients with this every day.
Yeah.
Let's talk about what it is.
Okay. So first of all, IUD stands for Intrauterine Device. Okay. So this is a type of long-acting reversible contraceptive, also known as a LARC, is how they abbreviate that.
Okay.
And this specific one is inserted directly into the uterus. So it's this little T-shaped thing with little strings that hang down at the bottom of it. And whenever it's inserted through the cervix and it opens up into the uterus. So the top of the T should sit at the top of the uterus. And so it sits in there.
Okay.
There's two different types of IUDs. There's either a hormonal IUD or a copper IUD. And we've touched on this in other videos before. So the hormonal IUDs contain a specific type of progestin called a levonorgestrel. Again, it's a progestin, not a progesterone.
Okay.
We have a video on this. Go check that one out if you're confused on the difference between the two of them. Progestin is a synthetic version.
Okay.
So this is not a natural hormone that's in this one. So there's different brands of hormonal IUDs. They come in different sizes, different doses. You'll hear like the Mirena is probably the most popular one that we hear. The Liletta, Kylena, and Skyla. There's 4 on the market right now.
Okay, and those are all the hormonal ones?
Yes, those are all hormonal.
Okay.
The difference is just how much progestin is in it, how much it's releasing every day, and how long it's approved to be in.
Interesting.
So the longest approved one is 5 years currently. Some doctors are letting it go longer than that now, but FDA approval is for 5 years. The shortest one is for 3 years.
Okay.
So again, a long-acting contraceptive. It's put in, it's left alone for 3 to 5 years and helps to prevent pregnancy. Then you have the copper IUD, and so this is the Paragard. Paragard is completely hormone-free, and it's approved for 10 years of use. Either IUD is effective, 99% effective at preventing pregnancies.
Mm-hmm. That's super interesting. Like, my brain's going all over the place because one, there's a lot of choice here. Like in my head before we started this episode, I'm like, okay, you either do an IUD or you don't. Yeah. But you can decide to do an IUD, and then there's like a plethora of choices you've got to make.
Yeah.
This can be very confusing.
Yeah. And there's a lot that goes into it that you need to understand before you make the decision to do an IUD.
Yeah.
So understanding how IUDs work is super important. Okay. So with a hormonal IUD, this works because the progestin is acting on the endometrium, which is the inside of the female uterus, to suppress growth. Growth of the endometrium is what creates that little cushion. So if we have a embryo, it goes to the endometrium, has like a little cushiony pillow to implant on. So the progestin portion of the IUD is preventing that thickening from happening. So we're not getting that cushion there.
Okay.
The endometrium becomes really insensitive to the estrogen that's produced by the body. So therefore the estrogen can't tell the endometrium to grow. The progestin also thickens the cervical mucus, so it makes it a little bit harder for sperm to actually get through, kind of slows them down, makes it a little harder for them to get where they would need to go.
Okay.
But a key point here that they don't talk about often, for a lot of people, it doesn't stop ovulation.
Huh. Okay, so you still have a period.
It's a very common misconception. You can still ovulate, you can still have a period.
Okay.
So some women have no periods. No periods doesn't mean they're not ovulating, though.
Okay.
Gets a little complicated there. So studies show with the Mirena specifically, after 1 year of placement, about 45% of women are still ovulating. Now, whether they're having a spotty cycle, a full cycle, or no cycle, that can vary. But 45% of women are still ovulating. By year 4 with the Mirena, 75% of women are ovulating. So what does this mean? Technically, sperm could potentially get through. There could potentially be an egg. There could be a connection that creates an embryo. This is something I always like to point out to patients that I feel like most OBGYNs don't. If we believe in life at conception, and it's all about what your beliefs are. But if you believe in life at conception, there is the potential for conception with an IUD.
Okay.
It just can't implant. So that's something that I think
Got it.
every patient needs to know.
Yeah, that's an important piece of information.
Yes, yeah. And let me tell you, they don't tell you that piece. Because I do think that would be a deterrent for some people.
Sure,
Like you
absolutely.
could potentially be creating an embryo.
Yeah.
The likelihood is low, but it still absolutely could happen.
Yeah.
And so, like I said, if that embryo is created, the likelihood of it having somewhere to implant is very, very low. So it just would not have anywhere to go. It would just be passed or reabsorbed, but there is a possibility there. And again, with the hormonal IUD, periods are typically lighter or non-existent. It varies person to person.
Do people get on an IUD for that purpose?
Yes.
Okay.
Mirena is the highest dose IUD, and that one actually carries the indication for heavy periods.
Okay.
Like you can put it in just because you have heavy periods.
Got it.
So there's some women that are like 50 years old and their husbands have vasectomies. They didn't need it for birth control, but they'll use it to control the period.
Got it. Okay.
Yeah. So it is a possibility. Then we switch over to how the copper IUD works, because this one works very differently. So again, that one's the Paragard. And the copper IUD works by preventing sperm motility and then also affecting sperm viability once it gets into the uterine cavity. And it does this, and this sounds terrible, it does this through a localized cytotoxic inflammatory response.
Doesn't sound good.
The word cytotoxic kind of throws me off a little bit there. So it literally causes so much inflammation localized to the uterus that if sperm do get through the cervix, they should die off in the uterus before they could make it out to fallopian tubes and connect with an egg.
And the way I'm hearing that is that it's more about the sperm in the copper one. So that's why it's not affecting a woman's hormones.
Right.
Because it's really, I'm with you.
It's there to try to destroy the sperm, but then also that inflammation that it creates within the uterus makes a very uninhabitable environment. So if you did have fertilization, the likelihood of implantation, again, would be super, super low because the environment in the uterus is not very friendly at that point.
Got it.
So like I said, these are, again, cytotoxic. So because of that, these actually are also approved for emergency contraceptive. So if it's inserted within 5 days of unprotected intercourse, it can prevent an unintended pregnancy because it makes the uterus less inhabitable. So there are some people who will use it for that.
Interesting.
Yeah. Not a great thing to go get an IUD thrown in for, but it is approved for that. All women with a copper IUD still ovulate. It does not affect ovulation. So you will still ovulate every single month. You will still have a period. Copper IUD is known for making periods much worse. And they will warn you about this. Periods typically get heavier. They typically are more crampy and painful, and usually they're a little bit closer together. Like we can have a lot more breakthrough bleeding and spotting and all of that. And I've seen this in my patients. I used to do women's health where we did a lot of these. And a lot of women came back complaining about their copper IUDs because of the amount of bleeding and pain that they would have with them.
That is interesting.
Yeah.
Goodness gracious.
So it's not top of the list of favorites for most women once you talk about those potential side effects. But for women looking for something that's non-hormonal but needing something that's a long-acting, the copper IUD is an option. Of course, with any procedure, with anything that we're doing, there's the potential for risks. So the common risks that they should talk to you about whenever they're consenting you for this, with either type of IUD, there is the risk of uterine perforation, meaning they accidentally go too far and they rip through the uterine muscle and make a big tear with the IUD.
During the procedure?
During the procedure. It can also happen afterwards, and I have seen that. I remember years ago when I worked in the hospital, we had a patient that had to actually have it surgically removed. The doctor doesn't think he perforated the uterus at the time, but when they went looking for the IUD, it was floating in the abdominal cavity. Got out there some way. We don't know how, but so it can happen. It can go to places that it should not be. It can migrate away from where it's originally put. So it's supposed to be up and down, sitting in the uterus. They can get turned all crazy to weird directions. It can actually embed into the wall of the uterus, and it can fall out.
Okay.
Okay.
And how would you would know that? Just you'd have to go back to the OB?
Yeah. So whenever you have an IUD, typically the OB, there's strings on the bottom of it, and that's how you pull the IUD out when it's time to take it out. Those strings hang down through the uterus or through the cervix. So a lot of times they'll tell you, like, check your strings once a month to make sure that it's still there, and you can actually feel them on the cervix. But also going to the OB, they can visualize the strings, or they can do an ultrasound or an X-ray to make sure where it is, if it's supposed to be where it is. So like I said, it can fall out. There is risk of infection with this. If they're doing the procedure correctly, cleaning correctly, all of that risk is pretty low, but there is the risk of infection from insertion itself. Slight increased risk for different types of vaginal infections, yeast infections, BV, things like that, which can lead to pelvic inflammatory disease. You have literally a route for the bacteria to travel up into the uterus. And so in practice, I have seen women typically have, if they get into that chronic infection, it can be hard to get rid of. Like, they'll come in and be having chronic BV or chronic yeast infections. And even though the paperwork doesn't say that it's from the IUD, you pull the IUD out and the infections have gone away.
Interesting.
So I have definitely seen that in practice. Of course, there's pain with insertion. If you actually knew the process of getting this put in, if women could see it before they did it, they probably wouldn't do it. It hurt me to do it to people. So it can be painful. A lot of times they don't medicate for it. They tell you to take some Tylenol, some ibuprofen before you come. So it's definitely an uncomfortable procedure.
I would imagine.
Lots of cramping with it.
Yeah.
And then, like I had said, risk of heavier cycles with the copper IUD. So that's the normal stuff that they'll tell you.
Okay. What don't they tell you?
But there's a list for that too. So the risks that they don't talk about. Number one, with the hormonal IUD, increased risk for breast cancer. They'll tell you there's a decreased risk for cervical cancer, decreased risk for ovarian cancer, which there is. There is a slight decreased risk there. What they don't tell you is that there was a study done. It was researchers at the Oxford Population Health's Cancer Epidemiology Unit. Anyways, they did a study on all these women using different types of birth controls. And with the IUDs specifically, they found a 21% higher risk for breast cancer with IUD use.
How
21% higher.
Wow.
So that's significant.
And that's any IUD or?
The hormonal.
Oh, the hormonal.
IUDs.
Okay.
Yeah,
Okay.
Any type of hormonal IUD. Once it was removed, the risk does continue to go down year by year. So the longer that it's been out of your system, that risk does lower. But 21% higher risk of breast cancer.
Wow.
And the reason that some of the doctors don't talk about this is because they're led to believe that the effects of the hormonal IUD is localized to the uterus. The IUD is in the uterus, the hormones are contained within the IUD, so they're just told hormones stay within the uterus. They don't have an effect anywhere else. But there was actually a study done in 2021 where they did breast MRIs of women before they had an IUD placed and then after they had it placed. And then they did the reverse. So they took a set of women who had IUDs in place and then had them removed. And they did the MRI while they had the IUD in and after they had the IUD taken out. So they did it both ways. 47% of women showed breast changes on MRI with an IUD in place.
The hormonal or?
The hormonal IUD.
Okay.
Yeah.
Jeez.
So that progestin, they tell you it stays localized to the uterus, but studies are showing that it does not. It can have a significant impact on breast tissue and risk for breast cancer. So that's a pretty big one.
Yeah. Goodness gracious.
Also with the hormonal IUD, increased risk for anxiety and depression. So studies have shown that young women who use a hormonal contraceptive of any kind, including an IUD, are actually 3 times higher risk for suicide than women who have never used any sort of hormonal birth control.
Wow.
So that includes oral contraceptives and everything, but IUDs are in that family.
Okay.
Yeah, so big risk there. Possible side effects with either IUD: weight gain, mood swings, gut issues, headaches, acne breakouts, hair loss, ovarian cysts. The list goes on.
Yeah, a lot.
Yeah, a lot of things. And what can be so frustrating for so many women is you get this IUD in, you're not told any of this stuff. You start having these issues. You go to your OB and they say it's not from your IUD.
Right.
Can't be that. And so then it's like you're just kind of written off as like, you're crazy, you're imagining these things, or it's something else, we don't know. But no possible way it could be the IUD.
Well, and I know that narrative of like it's less harmful than your typical birth control.
Yeah.
Which clearly there's a lot of risk and a lot
Yeah.
of side effects that could happen from this.
Yeah, absolutely.
That's so interesting.
So it's just, people are basically just told it's safe and effective, which we hear about a lot of things nowadays.
Yeah, and these conversations aren't happening.
Yeah, these conversations are definitely not happening.
Yeah.
And I mean, I look back into my career in women's health before I really came into functional medicine, and I feel bad. I feel guilty because I had that same narrative, because it's the narrative that you're taught. In school, these are the things that you talk about. This is what you tell people. You give them these 3 options and they go with one, and your goal is to get them on birth control before they walk out the door. Birth control of some sort, whether it be IUD, pills, whatever. And all of these extra risks, they don't talk about. But the studies are out there. The research is out there. It's just not in the books that they're teaching the providers. And so then the providers are the ones turning around and educating the patients. And truly, patients are having to educate themselves to find things like this.
Absolutely. Which, are you on either side of the fence with this? Like, are you a pro or a con, or?
I always try to take the middle ground with patients of, let's look at risk versus benefit. Like, if you have a severe medical condition that it would be life-threatening for you to end up pregnant, then let's pick something that's the least likely to harm you to prevent pregnancy. But if we have the option of anything besides the regular types of birth control that's out there, like natural family planning, that tends to be the one that I am going to encourage patients.
Yeah.
Because again, being in functional medicine, our goal is to do everything as naturally as we can, embrace what the body is intended to do. And you can learn how to know when you're fertile, when you're not fertile, and how to reduce your risk of getting pregnant if that's not your intention.
Is there a, hormonal, or the hormonal IUDs versus the copper ones? Is there one they seem to both kind of not.
They've got some risks. So I told you the risks they don't tell you on the hormonal, which all sound bad. So I could see people being like, oh, let me just go with a copper one instead because there's no hormones. Copper one carries some risks they don't talk about too. So with the copper IUD, possible side effects: heavier bleeding, which we already talked about, heavier cramps, just worse periods in general, fatigue, pain with intercourse, increased back pain, increased risk of infections, hair loss, anemia, brain fog, anxiety, depression. So the copper IUD carries all those risks as well. And then the copper IUD also carries a very rare but serious risk of copper toxicity. So that means that the body is absorbing too much of the copper out of the IUD and out into the bloodstream. So high estrogen levels can increase the risk of toxicity. So women who have a history of like endometriosis, estrogen dominance in general, PCOS or ovarian cysts, any condition where you typically can see those people running higher estrogen levels, they're actually at a slightly higher risk for the copper toxicity from that IUD. Those high copper levels, even non-toxic levels, just higher copper levels, will affect your zinc levels. So it lowers your zinc, which then will impair the immune system, and it can have an effect on just overall like mental health and can cause a lot of mood swings. So that's if we're not getting toxic. If we do get toxic off of that IUD, we can have things like headaches, nausea, vomiting, fevers, diarrhea, dark bloody stools, muscle pain, extreme thirst, tachycardia, dizziness, fatigue, sudden mood changes, irritability, difficulty focusing. All those can be signs of reaching toxic levels from that copper IUD.
Wow.
So a lot of people, when presented with the possible risks and side effects, want to talk about other options.
Right.
So out of the two, I'm not a huge fan of either. If I had to pick one, I would probably go copper, because at least we're not increasing the risks of cancers with it. But in general, I like to talk about other possible ways to prevent pregnancy.
Out of curiosity, thank you for sharing that. Yeah. Is there like the longer you're on it, the higher the risk of some of these things? Or is this like if you get on it, you're still subject to all these risks. Does that make sense?
Yeah, anybody is subject to those risks. I've seen women within 3 months of putting in an IUD that are having like major complications with it and want it taken back out. And I've seen women who have had their IUDs replaced every 5 years for the past 20 years.
Okay.
And they're fine. The cancer risk with the hormonal IUD, it is what it is. And it only starts to decrease once you have that IUD out. So it's not like your risk goes from 20% to 40% if you've been on it for longer. The risk is what it is with the cancers. But as far as like the copper toxicity, that's more of a person to person is generally what we see versus how long you've had it in.
Say, for example, somebody watching is already on an IUD and is having good success. They feel okay. Is there anything they should be monitoring? Would you encourage like extra monitoring of their hormones or anything along those lines?
The biggest thing is if you're doing well with it, awesome, as long as you're okay with the risks of it.
Right, because those risks are still
are still there. Those
Right.
side effects can still pop up at any point. I've seen women who have IUDs in for 3 or 4 years, and then all of a sudden they start having an issue out of it.
Right.
And again, are being told, well, you've had this for years. This is not your problem. But when somebody finally takes the IUD out, the problem goes away.
Yeah.
So it probably was the problem. No specific monitoring necessarily, but if you start having these weird symptoms that nobody can place, weird fatigue has started up, you're losing your hair, you feel like you're crazy half the month because your mood is all over the place, just know it could absolutely be coming from that IUD, and that is a probability to consider.
Is there say somebody is like, okay, I need to get off my IUD. Is there a detox process, or is there does that make sense?
Yeah.
How do I restore things?
Yeah. So we have our birth control reset that I use for any type of hormonal.
There's a video for that.
Yeah, any type of hormonal contraceptive, doing that birth control reset. Now, it's worse when you're stopping oral birth control pills. And that's what that birth control reset is intended for. But the hormones in any way, shape, or form can cause some changes in the body. So we want to support detoxification, up our different vitamins that we talk about in that video, that sort of stuff.
Interesting. Robin, you explained IUDs. Is there anything else that you want to cover before we call it a podcast? You explained it. Thank you. Guys, IUDs, this is the episode. Share it with a friend. Share it with somebody who you think needs to see it. You name it, we explain it. We'll see you guys next time.
Don't go away.